Providence Behavioral Health Hospital has announced that it will discontinue inpatient psychiatric services. The Holyoke-based hospital, which is part of Mercy Medical Center, announced in March that its final day will be June 30th. I spoke by phone with Cindy Chaplin, who has been a nurse at Providence Behavioral Health for half of her 42-year career.
We serve the most vulnerable patients in all of medicine. Most of our folks don't have a support system. There's a lot of stigma around mental health issues and mental illness itself. And we really are continuously trying to improve the lives for these people. And now they sit in ERs and wait for days for beds because there's never enough beds. And now with our closing, they're going to even wait longer. They're waiting in areas that are exposed to other people, and they are at their probably lowest point if they're in the emergency room. So they may be acting out or they may be suicidal, and no one talks to them for days because the emergency room just isn't equipped to do therapy and to help people like that. They're really there to stabilize a little bit and send them to the psychiatric hospital. We at Providence Behavioral Health had the only children's inpatient unit in both central and western Massachusetts. And these children are really the sickest of the sick, and they're the most vulnerable. They don't really have a voice, and sometimes they've suffered severe abuse, and they're in the foster care system, and it's just really sad for them that they already have to wait to be in a hospital, and now they have to go either to Connecticut, Hartford area, Vermont, or Boston, and then their families can't be with them.
I'm glad that you raised the issue of children because I was going to ask you more specifically. This would mean loss of geriatric beds, adult beds, and those children's beds. So you think they're the most vulnerable in this proposal?
Oh, yes, because the lack of children's beds throughout the state has always been an issue. A lot of advocacy groups promote non-hospitalization of children because it is traumatizing, but sometimes they really need it to get stabilized on medications and to get therapy with the families at the same time. And without that bridge together, they're going to get lost in the system. And a lot of them are going to land up in juvenile court because they become assaultive after having trauma. They have a lot of rage, and they land up hurting people. So then they get placed in DYS, which is really no place for them.
So for the hospital's part, and we've invited them on the program to discuss their perspective, we hope they surely take us up on that offer. But as I understand it, they have said that this move is necessary because there's a shortage of psychiatrists and doctors to serve these people. So if the doctors aren't there, how are you going to? How do you remedy that?
Well, it's funny you should ask that because I get spam email at work, different recruiting agencies. Do you need a job? So I answered one of the recruiters about a month ago and said, yes, I need psychiatrists. And they sent me back 3 resumes for 2 nurse practitioners and a psychiatrist that would love to work at Providence Behavioral Health Hospital. And I'm just answering a spam mail that I had no idea who the recruiter was or what their business line was, but I received an answer that there was a psychiatrist with 7 years experience willing to work at the hospital. So I'm not sure how hard they looked. I'm not sure how much effort they put into it. I'm not sure if the compensation was very adequate because Bay State doesn't have an issue with psychiatrists. Holyoke Hospital doesn't have an issue with psychiatrists. Noble does not have an issue with psychiatrists. Bay State Franklin Medical Center doesn't have an issue with psychiatrists. Only Providence Behavioral Health Hospital has an issue with recruiting and retaining psychiatrists. So there's something a little off there.
In terms of your job and the jobs of your colleagues, it looks like about 200 people, if this actually goes forward as planned, closure on June 30th, will be out of work. And in previous press reports, the hospital system has said it would help, that there would be a comprehensive job placement program for you and others. Have you tried to use that?
Well, their comprehensive plan kind of fell through because of COVID. A lot of places aren't hiring, and they just started to hire, but there's no severance package for any of the people that are getting laid off. I'm very fortunate. I am moving to the detox unit, so I will not lose my job, but there are many people that have been there for years that will be losing their job. And maybe about 5 or 6 have gotten a job at Mercy, and maybe 2 at Johnson, and the rest are really looking to collect unemployment and don't have any job offers.
So do you know of those 200 that we thought might lose their jobs, how many at this point are slated to lose their job?
All of the 200 are going to lose. The total is like 400, and there's going to be half of us that will be staying, and the other half will be gone as of the 30th.
As I understand it, the Department of Public Health, when this first was announced, said that there needs to be a 90-day discontinuation notice and that there will be a public hearing that the DPH will be involved in. Did that hearing ever take place, to your knowledge?
It was by phone because of COVID, so it did take place. There was a number of psychiatrists calling in, a number of families. Every single person who called in said this was really unfortunate, that it was really a hindrance and really a detriment to our community by losing these beds. And the head of one of the Bay State psychiatrists called in and said Providence should not close, and he's our competitor because of the type of patients we take. So we take any patient that is in behavioral health crisis, no matter how violent they are, no matter their situation of payment, if they have insurance, don't have insurance. We are kind of the last leg of hospitals that do that. Other hospitals sometimes don't have the staff to control a very chaotic unit, but we were always very cohesive and worked very well together to do that. And now I'm not sure where these very ill people will be able to go.
Is it possible they could go to Holyoke Medical Center because it has filed plans to expand its behavioral health? So could they be served there in the future?
They possibly could in the future, depending on, again, if they partner with a for-profit agency, that's what they're looking for. Most of our patients are Medicaid, Medicare, and they pay very little. Usually a for-profit institution wants the regular base, insurance, not your Mass Health and your Medicare patients.
So we've been talking about Providence Behavioral Hospital, but this issue of beds closing or beds consolidating services isn't new to the region. And whether I'm covering this issue in Berkshires, in Franklin County, there seems to be a real tug for these type of services in Western Massachusetts. Do you know why that is, or do you have a sense? You've been in this industry for 20 years specifically for behavioral health and more than 40 overall.
Well, behavioral health is typically not funded as well as if you're doing someone's total knee or you're doing a surgery for a patient. Insurance companies pay a lot more for that. Doctors get to bill for that. When you're in behavioral health, it's one lump sum per day. So it doesn't matter how much services the person needs. They could need, medication every hour, and they could need 5 people to sit with them. They would pay the same amount as if the person who is very quiet and reserved and doesn't need a lot of medication. So there's really never been an ability to really put the revenue that is generated back into saving these beds because they're just trying to stay afloat.
What are the next steps for you as the plan calls for closure is June 30th?
So I am fortunate enough to be moving to the detox unit. There are going to be 2 units and an outpatient area that will be open. So the methadone clinic is remaining open. Our outpatient services that we have with Brightside remains open. And then the detox and the step down from detox will remain open.
I know that you've been a strong advocate. Is your hope that the decision might be reversed, or do you think that it is inevitable that this will close?
My hope is that it will reverse, but I guess on July 1st, I will probably be saying goodbye to many people and going down to my detox unit job. I don't at this point see that how they could keep it open because they've let go all of the people as of June 30th. So they've let go all the docs, all the nurse practitioners. So we would probably not be able to stay open.